Hello, everyone. I asked all of you guys a question on Instagram. That is, any questions you have about hair fall, you can ask me, and I'm going to answer all of them in today's YouTube video. I'm Dr. Tanvi Vaidya, by the way. I'm a board certified dermatologist and I'm a medical director of DermaMD clinics. Anyway, enough about me, but getting into the actual topic. I got an overwhelming number of responses to that question sticker when I put it on there. And you guys clearly had a lot of questions about hair care. So I've tried to answer most of them. A lot of them were very similar questions, which are the best shampoos, which are the best serums for hair growth, all of that. So I'm going to try to cover as many of those questions as I can. And I hope I've answered all of your questions at the end of this video. So let's get started. Now, one of the most common questions I got is, what is the best shampoo in the market for hair fall? Now, sorry to break it to you here, but a shampoo is not going to help you with your hair fall. There has been no shampoo in the world that has been proven to honestly help significantly with hair fall. A shampoo can be less damaging on your hair. It can dry out your hair a little less. It can help control your dandruff. To some extent, ketoconazole-based anti-dandruff shampoos can help a little bit with hair growth. But to be honest, don't rely on a shampoo to help reverse your hair fall or to help you with regrowth. Not gonna happen. The next question, again, a very common question, is graying because of aging. Can it be stopped or reversed? To cover grays, which options are safer? Now, again, sorry to break it to you again, but graying, when it happens because of aging, very, very few molecules are known to possibly even help slow the process down. If it's happening because of a nutritional deficiency or, premature graying, which happens in Indians under the age of 25, if it's happening in your teens, yes, then that's premature and certain molecules can help you. Supplements containing things like biotin or calcium, pantothenate, magnesium, zinc, these kind of supplements can help you. Along with that, certain molecules to apply topically on your scalp, which contain things like Gravers, are molecules that can help to increase melanin production at the root level. Even in premature graying, I've seen these things work in hardly about 20% of people, to be very, very honest with you. So don't waste too much time and money on it. If you use these treatments for about 3 to 4 months and they don't work, it's probably not going to work. Especially if you're over the age of 25, it's, I think, time to embrace our age and move on with life. It's probably not going to work. Coming to which options are safer to cover your grays, you can. I know a lot of people are uncomfortable with the idea of gray hair. I personally quite love the look of gray hair. Salt and pepper, who doesn't love it? But if you still want to cover your gray hair, you can use regular hair dyes. Make sure they don't contain PPD. Make sure they don't contain ammonia. Make sure they also don't contain PTD. These are common sensitizers which can cause allergic reactions. They can also photosensitize your skin and make you a little more prone to pigmentation and stuff like that. So definitely avoid those hair dyes. One more thing you can do is put Vaseline on your entire hairline so your hair dye doesn't come in contact with your skin. When you wash it off, make sure you're washing it off in a way that when the runoff happens, it's not going to come on your face. So these are just some more precautions you can take. If you're, however, allergic to any of your hair dyes, you can use hypoallergenic hair dyes, Cuticolor, Harkler. These are some common, hypoallergenic hair dyes that we prescribe in clinic. I also have a more detailed video about hair coloring, which I'm going to link up here, and you can definitely watch that video as well, so you get a more detailed understanding of it. Next question is a very general question, but I think it's an important question to answer. How to identify that you're on the path of hair fall? So a lot of us are worried that, my dad's lost all his hair or my mom's hair is super thin and am I going to be on the same track? I have started experiencing some hair fall and do I need to worry about it? Do I need to do something about it now? Yeah, that's an important concern, especially if you really want to retain your hair and, have a full head of hair by the time you're 50. So how you can tell is if you've had a sudden hair fall that started post any illness, post a sudden weight loss, a nutritional deficiency, you've gone on a crash diet and then you've had a lot of hair fall. That's probably something called telogen effluvium, which is a temporary hair fall, a temporary shedding. I know it can be very distressing. Just say, in post-pregnancy, you see a lot of hair fall. It can be very distressing. You lose clumps of hair at a time, but all of that hair grows back. So I wouldn't worry about that hair fall too much. Just a basic multivitamin, a peptide serum will help you regrow that hair. Your hair fall will stop in 2-3 months. In a year's time, all of that hair starts regrowing. You'll see that baby hair. But if you have a patterned thinning is when you need to worry. Like for example, in females, if you start losing hair from your central partition, which is your midline starts widening. That's when you know that's a female pattern thinning, which could be hormonal in nature. In males, when you have a recession of your frontal hairline or you start seeing thinning here, that's a male pattern thinning again. Both of these are androgenetic alopecia. This is what I would honestly worry about more, because this is longer term, it's longer lasting. Regrowth doesn't happen as easily, and you need to start treatments early. On that note, there's another really nice question, which is basically, how do I know if I have androgenic alopecia and it's not a temporary telogen? This is a very well informed person asking this question with the right terms. Now, as I said, telogen is a temporary hair fall, a peptide based serum. A lot of you have asked me questions about RCP based serums. So RCP based serums, a peptide, just multivitamin supplements, eating a good protein rich diet will help you fix your telogen within a couple of months. If not, definitely talk to your dermatologist. However, androgenetic alopecia is when you have this pattern thinning. Your options are going to be longer term. Yes, you can start with peptides, but minoxidil may be a choice you may want to think about. Certain hormonal medications may be a choice that you may want to think about. PRPs, injectable dutasteride, mesotherapies, all of these procedural therapies also may be something that you want to think about. So that's the broad difference. Look for the patterning. If you're still confused, go to your dermatologist. We basically do something called a trichoscopy. This is a dermoscope that I have here. With this, we put it on and we look into your scalp, we look at your scalp, and we look at certain signs called miniaturization, hair diameter diversity. It shows us indicators of whether there is a hormonal component to your thinning in that pattern distribution. That makes a huge difference in understanding early if it's hormonal or if it's just a telogen effluvium. And that makes a huge difference when you can identify it early, catch it early, and start treatment early. Next question asked by Dr. Ashish, who is himself a dermatologist, majorly into trichology. I think this is a viva he's doing with me. But Ashish, to answer your question, do you think RCP combination is actually superior to minoxidil? It actually isn't. There's a lot of studies coming up saying that Redensil is getting comparable to minoxidil, and it's almost there and you don't need minoxidil and it's better. But to be honest, none of these studies are very very strong clinically and evidence backed. RCP is good, I'm not denying it, but the amount of regrowth that you can see with minoxidil is not anywhere close to what RCP can achieve. So when I'm dealing with a pattern thinning, like a male pattern thinning or, severe female pattern thinning, I'm going to insist on a minoxidil, unless, of course, the patient absolutely cannot tolerate it or the patient absolutely doesn't want it, because, of course, that's always going to be a patient's choice. In saying that, minoxidil is something that you have to use lifelong, and a patient needs to understand that. The patient needs to be told that RCP you can stop after a couple of months or couple of years of use, and it's not going to cause reverse shedding or rebound shedding. But yeah, of course, no one's denying minoxidil is better. Come on. Next question is, applying hair oil can give nutrition to the hair follicles. Please explain. Now, again, this is a very big myth. As Indians, we are traditionally taught to believe that hair oil is everything. That hair oil is what keeps hair on your head. And that's honestly not true. I love hair oil as a conditioning agent. So there was a huge randomized control trial which evaluated a lot of evidence about different hair oils. They compared various hair oils. Most hair oils were only found to coat the hair length. That was all they were doing. The only two that also were found to prevent protein loss from the hair shaft was coconut oil maximally, and to some extent almond oil. So, Jai coconut oil, your grandmoms were all right, and absolutely go for your coconut oil, it's great. But in saying that, remember, these are conditioning agents. They will not help you with hair growth. The reason hair growth used to happen when people did chumpies with hair oil was because of the massage. So if you're suffering from hair loss, use a peptide or a minoxidil or whichever serum your doctor has given you and massage it in with your fingers. The massage improves the circulation and the lymphatic drainage, and it'll actually help you with hair growth. But don't expect your hair oil to work on hair growth. Sorry to burst your bubble, but even rosemary oil, though it's been marketed like crazy, onion oil, rosemary oil, none of these work on hair fall. I'm really sorry to say. It's all marketing. It's a huge market out there. And you don't have to fall for all of these marketing gimmicks that are going on out there. Next question by the same person is, if we don't apply anything on our scalp, not even coconut oil, does it create problems? Not at all. Absolutely not. please don't apply anything on your scalp if you don't have any issues. There's nothing wrong with it. Of course, use your shampoo when you wash your hair. But if you don't apply anything on your scalp, it's absolutely fine. If, however, you're facing hair fall or you're facing dandruff and you need to apply some topicals, that's a different story. But otherwise, go for it. Live minimalistically. That's the way to go. Next question is about postpartum hair loss. Now, postpartum hair loss, again, is a very, very big concern. I faced it maximally after my own delivery. I had a very traumatic delivery, and 2-3 months later, boom, like you could barely see any hair. Like I have pictures. I should actually find those pictures and put them up. I had lost so much volume. Now, why postpartum hair loss happens is when you're pregnant, during your pregnancy, the hormonal status is such that your hair goes into something called a prolonged anagen. A prolonged anagen is a prolonged growth phase. So you see very, very little hair fall happening during your pregnancy. So your hair is thick and lustrous and wonderful. As soon as you deliver, your hormonal status shifts. 2 to 3 months after that, you will see a huge amount of shedding. And when I say huge, I'm not kidding. People literally come collecting that hair, in little bags, showing us that aaj itna gaya, doctor, itna gaya. Like I'm going to go bald in just a few months. My baby's not going to recognize me. I was like, chill, calm down. No matter what happens, your hair is going to grow back, okay? Even if you do nothing at this point, your hair is going to grow back. Give it a year. All of the hair that you lose during this phase is going to grow back. So that's the biggest thing to note, because that stress of that hair fall is going to cause you to lose even more hair. So don't stress about it. There's enough to stress about in your postpartum. What is happening here is a telogen. So all of your hair suddenly has gone into that telogen phase. All that hair that was chilling in the anagen phase when you were pregnant has now suddenly gone into telogen, which is why you're seeing this sudden shedding. What you can do to cut short this duration of shedding is eat really well. I know everyone tries to feed you a lot of sweets and laddus and this and that, but try to work on your protein intake rather than your sugar intake. That's very, very important. Have a lot of fruits, have a lot of vitamins, vegetables, work on your micronutrients. That's very important. If you need a supplement, take a supplement and stick to an RCP based peptide serum to apply on the crown area of your scalp. Massage it in, leave it overnight. Do it every single day. Okay, you don't need a minoxidil. It's not safe during this period since you're lactating, but an RCP definitely can work for you. It will settle in literally 2 to 3 months with just this. If it doesn't, of course, talk to your dermatologist. Next question is it safe to wash your hair every day? They get greasy after a workout. Again, very, very common question. It is safe to wash your hair every day. Even if you have an androgenic alopecia or if you have any kind of hair fall, it is safe. I know the days you wash your hair, you'll feel like you're losing more hair, but that's hair that's already gotten loose. Nothing you do externally is going to actually cause, hair fall from the root level. So don't worry too much about it. The root level issue in an androgenetic alopecia is the hormonal issue which is causing the thinning. So don't worry about losing hair because of washing it. How often you need to wash is like this. Twice a week is absolute bare minimum. Even if you have a very dry scalp, twice a week you need to wash it to get rid of that scalp buildup and all the impurities and stuff like that. But if you work out, if you're sweating a lot, or if you just have a really, really oily scalp, listen to your scalp. If it's oily, if it's getting dirty, you need to wash more. It's okay to wash every day. Use a milder shampoo. Use like a really mild sulfate-free kind of shampoo with low surfactants, so it doesn't strip your hair too much and make your hair very frizzy. So use a regular mild shampoo, condition really well. Absolutely, you can wash every day. Just make sure you dry your hair well. Don't tie it when it's wet. When you start washing it every day, these are things that typically start happening. Then you start tying it when it's wet. So make sure you don't do stuff like that. But absolutely listen to your scalp. If you need to wash it every day, wash it every day. Does PRP work on hair-related problems and concerns? Okay, I first thought that was cancers, but concerns. How many sessions does it take to show visible results is the question. Yes, PRP works wonderfully. PRP is essentially platelet-rich plasma. It's a procedural therapy that we do. So we draw your blood like any routine blood test. We centrifuge that blood and we prepare a platelet-rich plasma, which is essentially a concentrate of growth factors that we derive from your own blood. So it's entirely autologous. It works extremely well. We personally in our clinic only use GFC, which also contains a preformed growth factor concentrate along with your own PRP. So it works really, really well. We do about 4 sessions every year. You can space it out at a monthly interval and then you're good to go for the rest of the year. And then you can repeat again next year. Usually we reserve these treatments for androgenic alopecias, which are longer term hair problems rather than just a short term hair fall. Yes, it works definitely very well. You'll get to see the results after you do about four sessions. Maybe by a third session, you start seeing the results. You might see a reduction in hair fall. You might see small hair regrowing here and there. Is it a replacement, however, for your regular treatments, your regular serums? No, it's not. It's an add-on. It works really well to amp up the benefits that you get from your regular serums. Along with PRPs, there's also a lot of other treatments available, like injectable dutasteride if there's a hormonal issue. Mesotherapies with various ingredients like exosomes have really come into the market, and they're giving very, very good results. So all of these options, of course, do help with your hair growth. Another question is, I use hair joy minoxidil 2% and have bought biotin man matters but not used it, which is efficient. Okay, I firstly don't want to get into brand names here. This is not a brand based video. But if you are a male, from your name, I'm guessing you're a male, and you're using a minoxidil 2%, I would say move to a 5%. Honestly, even for females, I start with 5%. 2% is far little to honestly make as much of a difference. And why not go to a 5%? So definitely, I would say go for a 5%. Also, if you have androgenic alopecia, I would recommend using a minoxidil with finasteride. Of course, all of this really don't do without a consultation based on something you've watched on YouTube. You can come and consult me, no problem. The biotin that you're talking about is not a replacement for minoxidil. Biotin is a supplement that you take. In case you have a biotin deficiency, it can worsen hair fall. Any supplements that you take are to counter any deficiencies, micronutrient deficiencies that you have because your diet is not adequate. So, you don't absolutely need a supplement always. If your diet is great and you're very confident that you're managing to meet all your recommended daily allowance of, every single micronutrient, you don't need a supplement, okay? But comparing biotin and minoxidil doesn't make sense because they're completely two different molecules working from two completely different angles. Minoxidil is increasing the blood supply around the hair root. It's trying to reduce the conversion of testosterone to DHT. So it's trying to reduce that androgenetic component. Biotin is just fixing a micronutrient deficiency. So they're two completely different things. Next question is, I have been seeing a lot of curly hair routine videos. Are these products good with respect to hair fall? Yeah, so again, this is a very common myth. I had a patient who came to me saying she broke up with her boyfriend because she used to do her curly girl routine. And her boyfriend told her that he thinks it's artificial and it doesn't make sense to do. Just firstly, come on, boys, what are you doing? Irrespective, curly girl products are completely fine to use because they are working on the length of your hair. The length of your hair is completely dead tissue. All you can do is condition it, which is all that curly girl products are doing. They're just adding conditioning. They're coating your hair. They're making it feel softer. They're making your curls stay in longer. Does it have anything to do with the root of your hair, which is responsible for hair fall or hair growth? No. So don't worry about it. You can absolutely use your curly girl products, work extremely well. It has nothing to do with your hair fall, okay? In saying that, there are some curly girl products with very strong hold. Those gels which are really hard, which, absolutely make your hair feel very hard. Some of these products can cause hair breakage. They may dry your hair out a lot. So make sure you're being a little careful with what curly girl products you're using. But don't worry, it won't cause hair fall from a root level. Next question is, which supplements should one consume to control hair fall? Again, a very good question because this is a huge market out there where people are just popping supplements even when they don't need any. Do you need every single supplement out there to work on your hair fall? You really don't, okay? We typically, when we prescribe a supplement for your hair fall, we are trying to address micronutrient deficiencies. So yes, biotin does help, but do you only need to keep popping biotin every single day for the rest of your life? No. Will biotin help if you're not deficient in biotin? No. So if you, again, as I said, if you're eating really well, you don't need supplements, but most of us don't eat well. The same tomato that you used to get in the market 40 years ago and the same tomato today, they have completely different nutritional values, the same tomato used to not have pesticides and fertilizers when they were producing it, and now most of the nutrients have been diluted down in most of the vegetables and fruits that we get, which is why if you test for your vitamin Ds, your B12s, most of us tend to be deficient. So if you're deficient, yes, you definitely need to supplement. Typically iron, vitamin D, B12, zinc, magnesium, all of these things definitely can contribute, and of course biotin. You don't absolutely need a supplement. If you do take a supplement, don't take it continuously for the rest of your lives. Take it for about 3 months on, 3 months off. There are certain supplements like hormonal supplements, hormonal medications, I would say, which are needed in certain types of hair fall. But of course, don't start these again based on a YouTube video. Just one thing I'd like to mention here, that biotin supplements, people are popping just over the counter like crazy. Just please note that when you check any blood tests, when you're on a biotin supplement, sometimes it can mess with the values of those blood tests. So if you're doing your annual health checkups or any blood tests, please stop your supplements when you get them done, because I don't want you randomly having messed up thyroid values because of a biotin supplement that you're popping. Can you tell me something about hair transplantation? Yes, I can unfortunately tell you a lot of things about hair transplantation because that is my job. So hair transplantation is a surgery that we do where we transplant little hair follicles from the back of your head to the front of your head where you have hair thinning. Who can it be done by is dermatologists, plastic surgeons, maxillofacial surgeons, nobody else. So please stop getting a hair transplant done from your dentist, your homeopath, your salon. It really shouldn't be done. Why people are dying because of hair transplants is also because of this, because there's no standardization in India. There's no government body stopping these people from doing it. So at least as consumers, we can be a little careful of where we go and where we do our transplants. The second thing is, how much does a hair transplant cost? Is it depends on how many follicles are being grafted. Like for example, if there's just a very small area where I need to transplant, I may just need about 1000 grafts, which is not going to cost much. But if I need to transplant on this entire area, it may go up to a good 5,000-6,000 grafts, which is of course going to cost a lot more. The cost of the transplant usually is based on the number of grafts that are being transplanted. The technique that is normally used nowadays is something called FUE, which is follicular unit extraction, where we individually extract one single follicle, transplant that one follicle into one slit, which is a much better technique than what used to be done in the past. The biggest part about a hair transplant that you need to remember is when you go to a doctor, try to look at the kind of hairlines they've created before. Try to look at some of the work that they have done. The most difficult part about a hair transplant is to create a beautiful hairline. In males, typically, you have a little bit of angle recession. You cannot have the kind of hairline that I have. You need a little bit of angle recession. The hairline that is made needs to have staggered follicles, little aage piche. So it looks natural. Nobody has hair all in one line. The multi-follicular units in which 2-3 hair are coming out are usually put at the back. The single follicular units are usually put in the front. So these are just small, finer nuances that only a surgeon who does it well would know. So make sure you're choosing your surgeon well. That's super, super important. When we do hair transplants, the surgery typically happens entirely under local anesthesia. So you're conscious throughout the surgery. We even take a little lunch break where you can eat your food and come back. The surgery usually happens on one day. If at all it extends to 2 days, it's because we're crossing more than 3,500 grafts, and it's not safe to be doing more than 3,500 grafts on one day because of the local anesthesia risk. So, patient safety is more important than anything else. So that's what we do. Your results typically start, looking really good by 3 months to 6 months. In a year's time, you'll never even be able to tell that you've done your hair transplant. Yes, you need to trim your hair down to about a 2 millimeter length before the transplant. So it looks good and it blends in really well. In certain cases, like in female patients when we're doing a transplant, and supposing I just want to cover this patch here, I don't need to trim all of your hair because, I'm just working on the hairline. So I can just transplant the follicles in this unit. We can cover it till it grows and reaches the regular length with the rest of your hair. You're usually good to fly out within just 3-4 days. So a lot of people who come in and fly in and get procedures done from us also fly out within 3-4 days. So you're absolutely good to go. Any more questions about hair fall, hair growth, hair transplants, what have you, you can ask me in the comments. Even if you have any more follow-up questions about these topics, you can ask me in the comments and I'll be happy to help you out. If you like this channel, please share, please subscribe, please interact, and please let us know that you like it so we can keep making more content like this. See you next time.